Begin.
Hi, my name is Dr. Kutural. I'm one of the doctors working in this clinic. How can I confirm your full name and age, please?
Hello, doctor. I'm Hadia, 14 years old.
Oh, hi, Hadia. How can I help you today?
Well, doctor, if you can give me some emergency contraception pills.
Oh, I see. I think I'll be able to help you with that. But before we talk about it in detail, is it okay if we have a small chat with you?
Yes, that's fine, doctor.
All right, Hadia. You mentioned that you're here for emergency contraception. Can you tell me more about it? When was your last unprotected sexual intercourse?
Yeah, I was last night.
All right. And can you tell me, like, for how long have you been sexually active?
It has been about 2 months now.
All right. And are you in a stable relationship?
Yes, doctor.
And for how long have you been with your partner?
It has been about 2 months.
All right. And where have you met? Can you give me some more information about your partner as well?
Oh, we met in school.
All right. And are you is your partner a boy or a girl?
It's a boy, doctor. I don't want to talk about him.
Oh, I can see that you're very nervous. I'm so sorry, but I need all of these information to help you better. And don't worry, I'm just here to help you.
Yeah, okay.
You mentioned that you don't want to talk about him. How is your relationship?
Yeah, it's good, doctor.
All right. And is he a classmate by any chance?
I don't want to talk about him, doctor.
All right. All right. Do you usually practice safe sex apart from the one that happened yesterday?
Yes, doctor.
All right. And have you ever been using any kind of contraceptive pills before?
No.
All right. And how about your periods? Are they normally regular?
Yes, doctor.
All right. And when did you have your last menstrual period?
It was 2 weeks back.
All right. All right then. What I'll do right now is that I'll examine you quickly.
Mm-hmm.
I'll do a general physical examination. I'll take your observations, including your heart rate, blood pressure, your temperature, and then we will discuss more about your some contraceptive methods, if it's okay with you.
That's okay, doctor. So all the examination that you did is normal.
All right. All right. So from the chat we had, I am really concerned about your relationship. Before we discuss more, is everything okay with you?
Yes, doctor.
You seem to be quite worried.
No, it's okay.
All right. Don't worry. I'll definitely help you with the emergency contraception. About that, you have a couple of options. I can prescribe you a pill that you should take within the 72 hours of the intercourse.
Okay.
And there is also an option about a copper coil being inserted, but in your age, I'd say the pill would be a better option.
Okay.
All right. And apart from this, like I'll give you the prescription, and also you mentioned that you normally practice safe sex, which is really good, because these pills can only protect you from pregnancy, but there are also many sexually transmitted infections.
Mhm.
So you should always be wearing a condom.
Okay.
All right. And is there any particular concern that you have, or do you need any help about anything?
No, I just want the pill, doctor.
All right. You can you can come to us whenever you feel like your mood is low or you want to share something. Me and my colleagues will definitely do our best to help you.
Okay. Thank you, doctor.
All right. And I'd want to see you again,
Okay.
if it's okay with you.
Yeah.
How would it work if I see you next week?
Yeah, that's fine.
All right.
What will that be for, doctor?
Um, I'd like to follow you up because um, I um, I felt a little bit concerned about you, and I really don't want you to feel alone in any case or to feel depressed. So I'd want to check in on you, and you can call us anytime if you feel depressed or if you want to share anything.
Okay, doctor.
All right.
Right.
I'm so sorry. I know the case, but I just couldn't make her talk.
Thank you. Yeah, I do
Yeah,
understand.
I just didn't want to be very I didn't want to ask too much.
No,
Would I
but
fail in such
you
a
did well. I
condition?
think you did well. There's something that you could, there's something else that you could have added up to it, but all what you did was definitely wonderful. That was very well done, I would say. But definitely there is something that's missing, and we'll talk about that in a while. A few things were missed, and they were really, really important for the case.
Mhm.
But it's not that what you did was not correct. What you did was correct, but could be done in a bit better way or in a bit different way. And having done them in a bit different way could add up to a bit of time, and then you can do a few more good things. We'll talk about them one by one. Right. Thank you. Thank you for coming forward, Dr. Aiku. And any comments about Dr. Aiku's presentation, especially the raised hands, I would like to ask Dr. Meena, Dr. Omnia, Dr. Fatima, Dr. Means. Any comments about how did she perform, and
I
what
think
were
I
what
think
were her, what were her strengths, and what was missed in the consultation? What could have been done better?
I think that she should have offered confidentiality, because the patient is purposely it doesn't want to talk about the partner, so she should have inquired more about the age. Maybe ask why she don't want to talk about him. Offering confidentiality makes the patient more comfortable.
Okay, right.
I think she didn't ask about any contraindication that might be, so she could prescribe the contraception or give her more options about her contraceptions.
She's giving
Yeah.
she's giving the emergency contraception pill, which is which is a one-off pill. Do you think she needs to rule out any contraindications for this POP?
No, not the emergency. I mean the options for any contraception, because the task only says that discuss further management and address her concerns. So she's here for contraception, right?
Yeah. No, she's here for emergency contraception pill. That's what she said.
Okay, but other than that, I think she handled it very nicely, and she was kind and reassuring. But I think only the confidentiality was important here.
Okay, that's a good point. Right.
Thank you. Can I ask something now that we spoke about this, if it's okay?
Yeah, go ahead.
I thought about because I knew I did a similar case recently, so I knew, and but I thought if I offer confidentiality and then I tell her that I'll tell to my seniors and I'll involve safeguarding, and then the confidentiality will be gone. So I thought
Very well done. That's a good question. So I'm writing all the questions from your side and I will answer them all together. Okay. So
okay,
confidentiality. Okay. Yeah. Go ahead. Dr. Meena, what are your comments about it?
Yeah, well, doctor, she did not teach her how to take the emergency contraceptive pills. I mean, she should have informed her that she will need to take it as soon as possible. And if she vomits, so she need to take another pill. She did not mention much information about the emergency contraception, and she did not warn her that even if she takes the emergency contraception, there is a risk for pregnancy to happen. So she needs to check if the next menstrual period is delayed. She will need to do a pregnancy test, and if she experiences any tummy pain or any bleeding from the front passage, so she needs to come back to the clinic.
That's right. Yeah. She could have done all that. Yeah.
Mm-hmm.
All right. What else? Dr. Omnia, Dr. Sharmeen, you've got some comments about it?
I think she should ask about the family and the support who know about the relationship.
Okay. Yeah.
And by any chance, did she practice sex under force, under alcohol, for drugs? Just to rule out, even if she didn't answer, but we should ask. Right.
Very well done. Very well done. That's correct. We should ask that. What next? Dr. Fatima, you've got a comment. Dr. Sharmeen, go ahead.
I don't have any more.
No, you don't have any. Okay.
Everything is said, I think.
Okay. Anything else? Anything else that was missed? I mean, all what we've talked about is definitely important. And it's good not to miss that, but there is something else which was missed. Anyone who would like to comment on what could that be? What could be so critical which was missed?
Yeah, she should have asked that if her relationship is her parents know about her relationship or not.
Okay, good point. Yes, that's
about. Did she talk about to her parents? And
right. Okay, what else? Yeah, I can see a few more hands raised. Go ahead, please. Yeah.
I think.
Yeah. Go ahead. I think.
She asked her about the she used condoms before, and she said yes. Just I think that she should have said, why didn't you use it this time?
Yeah, we've already talked about that. What else? Anything else? Anything else?
I think at the first, it's better to ask why do you want emergency contraception.
Yeah, she did ask
the patient. And let the patient herself tells us that what happened.
That's true. That's true. I agree with that, because Dr. Oiku said that when was the last OSCE, the unprotected intercourse. So instead of asking that, you can ask that, why do you want the pills? That's a better question. But it's completely okay. Even if she, for example, if he asked in the wrong way, but anyhow, the question led to the same information, it's going to be considered fine. There is something else. What else?
It's about if patient doesn't open up to us, or we are not sure about the partner, then we have to involve the social services.
Very, very, very well done, Dr. Jannatul Adneen. Excellent. Very well done. We've just done that in the course very recently, and I can say that you must have practiced it quite recently as well. Very well done. Yes, very important. Why didn't anyone think about informing the social services in this one? What do you think? Should we be involving the social services or no? The patient hasn't opened up to you. The
Yes.
patient was quite adamant. You tried a lot, but the patient did not tell you about her partner at all. What should you do? Should you involve the social services or no?
Well, doctor, actually, I was thinking that we need to keep her in the clinic for a while.
Why?
Until we involve the social services.
Why? Why do you need to restrain her? There's no concept of restraining patients who have got full mental capacity with yourself in the clinics and stuff.
Okay.
Okay?
Okay.
But you've got all the details of the patient, so you can involve the social services, because every patient who has registered any particular surgery, all his details or all her details are available there. So you don't need to restrain any patients who have got full mental capacity for any reason. You can simply involve the social services. So now, very important point here. There is one more important point that was missed. Anyone else would like? Now, it's just that I'll give you one chance to speak up. Very, very, very important point. What was that which was missed here? One was social services. Dr. Janat Al-Adneen talked about that. There's one more extremely important point which was missed. Can anyone say about it?
As the patient is under 16, about the mental capacity, do we have to...
Very, very well done. Yes, this is what was very important here. A mental capacity. Do you have an idea what can happen if you don't take these pills? Very important question, not to be missed. You need to know if this patient has complete if this patient is Gillick competent or not. So you need to know this information. So all that you need to know when a young patient is coming to you for contraception, you need to know whether this patient has the competency or not. She understands what's the purpose of taking these pills and what will happen if she doesn't take these pills. And also you need to make sure of a safety. And in terms of safety, with the Fraser's criteria, you're trying to find out who the partner is, what's the age, what's the relationship, if it's an authoritative figure, who it is, where the patient may or may not sometimes open up to you. Right, so let's go to the feedback from the beginning. So starting from the beginning, Dr. Aiku started really well. She started with reassurance that don't worry, I will definitely help you out in that. But then she started the consultation by saying, when was the last unprotected intercourse that you had with your partner? Can you tell me how long have you been in this relationship? Are you in a stable relationship? How long have you been with your partner? Where did you meet him? Was it at school? Is he a boy or a girl? I can see that you're nervous. So she acknowledged her nervousness, and then she talked about a bit more information. We need this information to help you, whether who your partner is. So she was trying to ask the details about the partner, but the patient was not opening up, and she was trying to say that we need this information in order to be able to help you. Don't worry, we want to help you. How's your relationship? Is your classmate? It's all right if you don't want to tell. And then she went on to ask about contraception pill, periods, regular LMP and everything. And then when she went to the management part, so I'm just repeating everything that she did up till now for those who joined later. And then she went on to do an examination where she checked the observations of the patient and did the general physical examination, and then talked about ECP. I will give you the pills, but I want to talk more about your relationship. You seem worried, and there are a couple of options: pills, and then the copper coil. Then you told me that it's not suitable for you. If it is not suitable, don't talk about it. Okay, so I'll talk about it in a while when I'll tell you the whole approach. Then you talked about prescription of the pills, contraception. You can come to us whenever. So the good thing is that when she did not know what to do, she said that I want to see in a week's time. That was okay and beautiful, I would say, but definitely not adequate. So we need to do an adequate consultation with the patient. So how we can start this consultation from the beginning? You can start by asking the patient, how can I help you? Doctor, I want emergency contraception pill. Right, I can help you with that. Can you tell me, why do you want these pills? So I'll just give you the approach as into what you can ask the patients. Why do you want these pills? Have you ever used them before? The patient tells you about her last night event. Ask her, is it the first time that you had this OSCE? And what were you using before? What happened last night? Was it under the effect of drugs, alcohol, force, anything like that at all? And how is your relationship with your partner? Is he caring towards you? How does he treat you? And how long have you been together? Can you tell me a bit more about him? Where did you meet him? What's his age? So now the patient is refusing. Is there anything that's bothering you, Adya? Is there anything that's worrying you, that you look a bit shy or a bit hesitant? Is there anything that you want to discuss? Feel free to discuss anything. Let me reassure you that whatever you discuss will remain between me, you, and the medical team. Please feel free to share any of your feelings with me. No, doctor, I don't want to talk. I don't want. Is there something that's worrying you at all? No, doctor, there's nothing. I don't want to talk about my partner. I don't want. She's not agreeing. Right, that's fine. That's fine. Right, so can you tell me about your last menstrual period? Are they regular? Any problems? Any STIs in the past? Have you ever considered any regular contraception? A bit about your background health. Ask about medical conditions, medications, allergies. Ask her about whom do you live with, how are your studies going on, and do you have an idea what can happen if you don't take these pills? And Hadia, I want to ask you again, you look quite worried. Are you worried about anything in particular in terms of your partner or anything at all? And then you ask her about any other expectations apart from getting the pills. And then you go on to the examination. When you go to the examination, check her observations, especially her blood pressure, and then you go on to the management. In the management, how do we go about the steps of management? Tell her that, well, I will give you the pill. You don't need to say that, take it for the glass of water in front of me. No need to do that. Why are you commanding the patient? Don't do that. Tell her that, well, you can take the pill. If you vomit within 1 to 2 hours, let us know. We'll be there to give you another pill. Well, this pill is not 100% effective. So if you do not get your period in the next 2 to 3 weeks, come back and we'll do a urine pregnancy test for you to make sure everything is going fine. Is that okay, Hadia? Make it a two-way consultation as much as you can. Well, Hadia, as I see you're not using any regular contraception, I would encourage you to use one. And for that, if you're happy, we can book you in for another consultation. How does that sound to you? That sounds fine, doctor. So you don't need to go into the details of the contraception at all. This is what you needed to do and you did. And now at the end of the consultation, encourage her to talk to her parents. Encourage her to use barriers always to prevent any STIs. And now in the end, you tell her that, well, Hadia, I'm quite concerned and worried about you. As I asked you a few times, but you do not want to talk about your partner. And to me, you look really worried and shy today. And I'm feeling worried about that as well. So I'll involve my senior, and we might need to involve the social services. Social services? Why, doctor? I can see that you're concerned about involving the social services, but it's just to make sure that you are in safe hands with safe people. So it's really important for us to make sure that you are safe. Doctor, are you going to tell my parents? What would be the appropriate answer for this question? Any one person, please. Whosoever can open up your mic and tell me. If the patient asks you, doctor, are you going to tell my parents? What are you going to say?
Well, no, as long as you do not want us to do that, so we will not do it. And it would be better if you can inform them on your own. What do you think?
So, Hadia, we will definitely not inform them at all, as I promised. But if the social services are concerned about anything, they might inform your parents about things if you are in an unsafe relationship. So it's really important that you inform them yourself. So that was a good answer, Dr. Meena. Excellent. So this is how you go on to inform the patient what you're planning to do. There were a couple of comments from the previous candidate. Dr. Irfan, just a moment. Let me just finish this one. So one of the candidates said earlier that Dr. Oiku should have talked about the contraception in detail. No, you do not need to rule out contraindications. You do not need to talk about regular contraception in detail at all. Just try to find out if she's using one or not. If not, then offer her a new consultation for that. Encourage her to use barriers now, in the meantime, and even after that to prevent STIs. Confidentiality. It is always good to offer confidentiality. There are certain situations where you can break the confidentiality. For example, if you're worried about the safety of a person, you can break that confidentiality. So please do not hesitate to offer confidentiality to your patients. Didn't teach how to take the pill. Yeah, so this was another comment that she did not teach how to take it. Yeah, so she can tell that take one pill now, and if you vomit within 2 to 3 hours, come back. So I've already highlighted that point as well. So these are all the important aspects of the whole consultation. So if the patient is, so my important advice here would be, if the patient is not opening up to you, either that is this consultation or a different one, please do not force on your patients like that. Never force on your patients. Try to go slow. Look at them. Be their comfort in that consultation room and offer them help if they want. If they're not opening up and you are worried and you are concerned, you being worried and concerned about a patient's safety is more than enough for you to involve the social services. You do not need any evidence at all in order to involve the social services. Is that clear? Is this important point very clear to everyone? You could always ring the whistle when you think that, the green whistle, when you think that the patient is in unsafe hands or is not safe at all. Is that clear? Dr. Oiku, is that clear to you, what we talked about?
Yes, thank you very much, Doctor.
Most welcome. Excellent. Overall, you did well. Dr. Irfan, I think you had a question. Someone who was going with a question, but I think got stuck in between.
Doctor, I'm not that someone, but I have a question.
That's fine. Go ahead, please.
Okay, so does this go on every other case, like domestic violence? What if she's not 14? What if she's not below 16? If she didn't open up and we suspect domestic violence, so we should tell her that we will involve the social services as well, even if without an evidence.
What's your question? What's your exact question? I didn't understand that.
If the patient is not below 16 and we are suspecting something that is going on wrong, like domestic violence, so should we also tell them that we will involve the social services?
So your question is basically that if the patient is an adult, not a minor, is a major, and is in an age group which is not elderly, neither elderly nor pediatrics, and the patient has got full mental capacity and does not want you to involve the social services, whether you should then involve or not. That's what your question is.
Yes.
So first, I would prefer if anyone else from the call can answer this question from the link. Anyone else would like to answer? Anyone of my candidates or anyone else who would like to answer this question at all?
Yeah, well, doctor, can I answer it?
Yes, please. Go ahead, Dr. Mina.
Okay, so if the person is over 16 and she's mentally incapacitated, so we can respect her wish if she does not want the social services to be informed, but we can tell her that at any time, if you change your mind, so you can come to us and we will help you with that.
That's correct. So your job is to give all the information to this patient. What type of help and support is available for this patient outside this GP clinic and outside her home? So your job is to inform her about all the options that are available. So you empower her with all the knowledge, give her resources, tell her what resources are available, what you tell her about shelter houses, you tell her about 24/7 helpline, you tell her about financial support and stuff, job support and stuff. because those are the main fears of patients who are in that age group, that if I leave my violent or partner who is a perpetrator of that violence, what will happen? Where will I go? Where will I get the house? Where will I get the shelter, money, food, and all those things? So your job is to empower your patient with knowledge. And once you do that, it's the patient's wish that you need to respect. So now there's another question. Let's suppose, for example, as a lead to this question, as a next limb, for example, if this patient says, if you ask her, do you think that you're safe to go back home? And if she says, no, doctor, I don't think so. I'm not safe to go back home, and I think he's going to kill me tonight.
Yeah, then I will have to admit her.
She's saying, I don't want to be admitted.
Okay, then we'll have to, if she has this concern, then I have to involve the police as well?
100% yes, definitely. Excellent answer. You definitely need, if the patient says that my partner is violent, he hits me whenever we have an argument, he becomes violent in whatever way, either that is physical violence, sexual violence, verbal violence, financial, whatever type of abuse that is, let her decide whatever she wants. But if she's saying that the moment I will go out of this GP surgery, or if I go back home, I'm sure he has planned to kill me tonight, he has got a plan in place, in that situation, you always need to involve the police, even if she has got full mental capacity. You are the GP and you knew that he's going to kill her tonight. You knew the plan. So you are going to involve the police in that situation. Any patient who is in the pediatric age group or in the elderly age group where you think that they are dependent, they have become dependent over their children or stuff, that is when you, over the parents or over the children and stuff, that is where you need to involve the safeguarding services regardless of their wishes.
Thanks, doctor.
So what is the age limit for this? I mean, what is the age cap for involving social services?
So for the pediatrics, it's below 18. And for the elderly, it is usually people who are above 65 and you think that they are dependent. And you can see, being a GP, you've been visiting the patient at home, or the patient has come to you in the GP, and or the patient is admitted in the hospital. And that is when you observe that the patient has got a lot of thumb marks on different parts of the body, a lot of bruises of different ages, and you think that some sort of violence seems to be going on, but the patient is saying, no, everything is okay, my children are very loving, I think it's okay, it's okay. You can always involve the safeguarding services in that situation.
For this station, like 14 years old patient, but
yeah,
if she has, I mean, she was talking about her partner.
We've already discussed that. In her case, you are 100% going to involve the safeguarding services because she is in a pediatric age group. Even if she has got full Gillick competency, but she is in an authoritative relationship where she's in a relationship with her uncle or someone way older than her, or who is a teacher, who is in a relationship of trust, you are definitely going to involve the social services.
Thank you, doctor.
Most welcome. I hope that's clear. Okay, all right. Any other questions at all about this case first, and then we can go to a couple of questions about other cases, if any? No, I think we are done with this one. We did it quite thoroughly, starting from the beginning till the end, and did discuss a few other things around it as well. So if any questions about the cases and or about the exam other than what we've